So, a timely topic given the situation we are currently living in. Let's talk a little bit about the immune system as it relates to its anatomy and its functional anatomy, as we've done with the other systems. So, when we talk about the immune system, we really are talking about immunity, and we look at it in terms of two distinct lineages of immunity. So, we talk about them as being lines of defense. And the first line of defense is all of the external structures and secretions which are inherent to us. These are things that are conserved through evolution. These are the structures that are going to set up a defense perimeter around the body so as to prevent anything that is pathogenic from coming into the body itself. So these are going to include things like skin, mucous membranes, hair, cilia projections, oils, saliva, sudoriferous, and sebaceous secretions. The second line of defense is more of an innate or an acquired immune structures. These are things that are derived through speciations within the evolutionary process and occur over one's lifetime. So these are going to involve the active and the passive responses that we see in response to immunity, where we're going to have things like lymphocytes, leukocytes, antibody productions coming from the B lymphocytes, cytotoxin responses, and uh, cyto and chemotoxic responses to various pathogenic entities. This second line of immunity is what leads to what's referred to as immunocompetence, and that is our ability within the immune system to recognize and respond to distinct pathogenic entities. In this immunocompetent response, we have two distinct types of acquisition that could come about. One is referred to as active acquisition. That is, I get exposed to the pathogen. The B cells and the T cells learn about the pathogen and its antigen markers and go about being able to develop the antibodies in response to an infection. The other type of immunity that comes about through this second line of defense in terms of acquired immunity is the passive acquisition, and passive acquisition occurs through vaccination. Vaccination is both the injectable sterols that we would get through a vaccination sequence, but it also is the passive vaccination that we get through responses within breastfeeding, and in terms of getting antibodies that are coming from the mother, as well as seeding of bacterium that comes from the mother through breastfeeding. So let's take a look at these structures in terms of defense mechanisms as relates to what we'll see externally versus what we'll see internally. Most of the external structures are going to be non-specific. They're going to be first line defense mechanisms, which means they're going to be more of that conserved pathway. And so these are going to include the things like the epidermis, mucous membranes, the hair and the cilia that we talked about within the respiratory tract. And what this is going to do is this is going to establish the physical barriers. Things are going to prevent things from coming into the body. If we can prevent any materials from coming into the body, then we're not going to have to worry about the next line of defense, the internal structures and the internal secretions. So you can think of this as kind of like developing a wall around the body in terms of like a castle defense, where we have the walls of the castle and then the moat of the castle, which will be the next thing we're going to talk about, where we're basically developing barriers that are going to prevent anything from coming into the body itself. The second line that comes into play here are any of the fluids that we look at. And so these include things like lacrimal secretions, saliva, urine, defecation, vomiting responses, vaginal secretions, sebums, oils that produce a protective film, perspiration, gastric juices, anything that is acidic like vaginal secretions, lysosome secretions from some of the immune cells. What we're attempting to do with the fluid component of this structural component is to develop an inhospitable environment for the pathogens that we're trying to keep out of the body, so that not only we're walling the body off like a castle walling the external environment off, but we're creating such an environment on this wall that the microbes that are attempting to infect us do not have a way to come in to the body. So what to remember is that we can't always prevent stuff from coming in. So one of the reasons why we want the epidermis to be contiguous with itself is to create that impenetrable line of defense around the body. But sometimes that impenetrable defense doesn't always stay intact. One of the things we have to remember when we're constantly taking on and off personal protective equipment is that we're constantly causing chafing to take place. And if we do not lubricate or moisturize the epidermis, we will start to have cracking within the epidermis that will provide entry points for any of the viruses or microbes or prions or any of the other pathogens that can come about causing infections. And so when we look at these structures, we talk about things that don't need activation, which are the principal structures, such as the lymph vessels and nodes, the thymus and the spleen, as well as some of the cells that are not going to need activation. They simply just need to come in contact with something that doesn't present the self antigen, such as the myeloid derived granulocytes, the eosinophils, the basophils, and the neutrophils, or the natural killer lymphocyte, which is going to be within the lymph nature of immune cells, but it doesn't go through the same type of maturation processes that we'll see that take place within the T cells and the B cells. We then start dealing with things that need to be activated and or need to undergo some sort of immunoacquisition. So things that need to be activated are some of the phagocytes, such as the macrophages and the monocytes, which means that they don't necessarily need to learn how to respond to the pathogen, but what they need is they need some sort of chemical signal, some hormone, what we refer to as the cytokine signal, which is going to say, we need these cells over in this area here because there is an infection or an injury taking place. The last bit of internal structures that are going to be the most specific are going to be T cells and B cells, T lymphocytes and B lymphocytes. These not only need to be activated, but they also undergo what's referred to as an acquisition response. That is, they learn what the pathogens are in terms of their antigens and how to go about developing, in particular, antibodies from the B cells so as to label, you put quotes around that, the pathogenic antigen as being the non self, so as to allow for the response from the T cells as well as from the macrophages in response to the infectious agent, what we refer to as the pathogen.